We are live. Welcome back to our next Tuesday topic. Today we're going to talk about the functional movement screen. We got one of our interns here, Matthew, helping demonstrate a lot of this. But this is something we'll do with a lot of our sports physicals, a lot of our athletic teams at the school here to get a baseline of how they move. Basically, this is kind of the blood pressure cuff of movement. It's not going to help diagnose anything or nothing really specific, but it gives us a good general idea of how an athlete or a patient's moving, and a couple things to work on to expose some of their weaknesses. Also great for post-injury. If someone's recovering from a torn ACL or something, this gives us a good guide to how they move and if they're ready to go back into competition or practice for their sport. So we'll get into it. Basically, there's 7 movements. There's a couple other little movement clearings to make sure they do well, but 7 basic movements that you get them moving. Nice and quick, nice and easy. Like I said, just a baseline of human movement. So first I'll have Matthew do is the overhead squat. So bar's going to be up over his head. There it is. Coming down into a squat. Perfect. And kind of looking for any glaring mistakes. If the athlete can't even do this, if they're in pain, obviously some of that stuff jumps out at us. Perfect. Next, step on up to the board, bar across your back. We'll go a hurdle step here. Awesome. Stepping on over. And we'll do this both sides, obviously. Another big component for the FMS, the functional movement screen, is looking at asymmetry side to side. That's a decent predictor of some injury or maybe just some movement inequality is looking side to side difference. Next, inline lunge. So bar can go vertical on your back here, Matthew. Obviously, there's more detail when we're actually running the test, but for the sake of the video, we'll go a little quicker here. Perfect. Wanting to get his knee straight down. Love it. And again, obviously, we would do this side to side and compare. And there's different rankings to kind of look at some data there. Shoulder mobility. So arms will come out like this, trying to reach up and over, touch your fists together as close as you can. Perfect. And now same thing on the other side, Matthew. Awesome. Active straight leg raise. You can go on your back here. Keeping both legs straight. Seeing how high you can get. Perfect. I love it. And then trunk stability push-ups. So flip over on your belly here. Let me move this out of your way. Let's see if Matthew's got this in him. Trying to press his body up as one unit, making sure he has enough in the name trunk stability here to do this. Awesome. And then rotary stability. So on all fours, he wants to touch same side ankle, reaching out, and then touch his ankle again. This one he actually nailed. Perfect. Extension clearing, so go flat on your belly. Making sure there's no pain here in his lumbar spine. Perfect. And then you can go flexion clearing, sitting on back. Same thing, making sure this is pain-free. And then stand on up here, Matthew. We'll go shoulder clearing. Again, making sure that's pain-free side to side. And then ankle range of motion will be our last one. Keeping both feet flat, wanting him to get that back knee, bring your toe up to your heel. Perfect. Wanting him to get that back knee as far forward, looking at the range of motion in his back ankle. So that's kind of a quick little movement screen we can do here in the office. Takes no more than 5, 6, 7 minutes, something like that. But it gives us an awesome baseline how the athlete's moving, gives us a good guide to see if they're ready to go back to their sport following an injury. So that was decent. I think you're ready to go. 8th grade kicker. Yep. Thanks for watching, guys. We'll see you next week. As always, leave any comments, questions. I love all your feedback. So thanks for watching, guys.